Gender affirming healthcare is a lifeline for many young trans people trying to navigate their gender identity. But earlier this year, the Queensland Government caused a lot of uncertainty for people trying to seek this type of healthcare. This was due to issues surrounding medical oversight and patient safety regulations. Looking past the political debates, what does this ban actually mean for young people, not only in Queensland but in the rest of the country? To get a better insight in this, I spoke to Sam Gibbings, the CEO of Transfolk WA. Hi everyone, I'm here with Sam Gibbings from Transfolk WA. Thank you so much for joining us tonight, Sam. How are you?
Thanks for having me, Tamsin. I'm doing really well. I'll briefly talk about what we do. So we're obviously Transfolk WA. We are a community peer-led organisation run by the trans community for the trans community. We provide support to transgender diverse people. In WA, we have a number of resources that are available, like guides on how to change your legal name. We have a number of online support groups and in-person support groups. We have an under-18s group. We have a trans youth space for 14 to 20-year-old trans and gender diverse sister girls and brother boys as well. You can find us at our website at the moment. It's www.transfolkofwa.org.
So, as we know, on the 20th of January this year, the Queensland Government issued a state ban on puberty blockers and gender affirming hormone care for new patients under the age of 18. Experts are worried about the damage this ban may have on young trans people, particularly in issues surrounding their mental health and their well-being. What's been the response from the Australian trans community to this ban?
I've seen a fair bit of outrage across the country. There have been rallies that have been put in place. So Trans Justice Project and a number of local community groups have gone together and done a few demonstrations. In WA, we had one in Perth. I think there was one up in Geraldton. There was one down in Albany, really just calling out the ban for what it is. It's a political decision that has no evidence behind it. This is a huge amount of fear-mongering by politicians, bringing an issue into light that isn't really an issue.
Yeah.
What we know for a fact is that there are significant wait lists as it is. So here in WA, people actually have to wait up to 2 years to access the gender diversity service. So if anything, we need more capacity for people to be seen. Yet, and to support that as well, like the majority of evidence in most medical bodies are actually supportive of under-18s access to puberty blockers. So it just doesn't make sense.
What are some interstate implications this ban is having on Western Australian trans people? Are people over there worried about what the future holds regarding their access to this treatment?
Yeah, I think there's a fear within the community who are quite nervous, who think that there's every chance, depending on how the federal elections go, that there could potentially be a similar ban put in place in WA. I'll say that based on what we've seen so far, the likelihood of that happening is pretty low. But in saying that, there has been a national review commission, so through NHMRC, to do a review into the standards of care for under-18 access to puberty blockers. We're cautiously optimistic, assuming that there's no additional political interference, that it would actually support what we already know, that access to gender-affirming treatment saves lives. It prevents poor mental health outcomes, and it leads to people being able to participate fully economically and live really fulfilling lives. So we can only hope that this is what's going to demonstrate that it would actually embody us and make us feel a lot more confident that we can go ahead with accessing treatments.
Have you guys at Transfolk WA seen an increase in demand for support services following this announcement at all and coming up to the election?
We were seeing quite a number of parents and people reaching out to us, really asking for support, asking for help, to get some reassurance that things will be okay going into the future. And we are trying to do that. We have a number of events that we've been planning. Last week we did a community tie-dye event, and on Monday we have a Trans Day of Visibility picnic at 4:30 in South Beach near the South Beach Cafe. So if you'd like to come around, we'll be there for a few hours just to kind of chill and hang out. just to counteract some of this negativity that's been happening.
So we know in August last year, the state government introduced the Birth, Deaths and Marriages Reform Amendment Bill, and that was a really big step in WA in the right direction for the community. Have you seen any specific impacts that this has had on the community at all?
But we're still yet to see the legislation take place in action. So the actual processes itself haven't yet come to be. There has been a commitment to abolish the Gender Reassignment Board, and there has been a commitment to essentially remove or change the medical interpretation requirement to essentially have a sexual reassignment surgery in order to identify as your preferred gender. Now, this has been a huge step where 95% of what we want is there. However, it doesn't go far enough. It still does require having to see a doctor or a psychologist to verify whether or not you are receiving what they call appropriate clinical treatment. And because of that, that adds some additional barriers that shouldn't be needed. Having to pay to see a doctor, having to wait to see that doctor or a psychologist, and then paying an additional fee to have your details changed, just adds additional pressure to a system that we already know is overburdened. What we want to see is the right to self-determine our identity. Something like a stat dec, for example, where you could just write a statement saying that I am this gender, have it signed off by an authorized person who can vet that signature, and then that's it. And that would reduce the amount of pressure that we see in the system. So there are a number of individuals within the community who are upset that there's still this requirement. Hence, we think it should be self-determined. But for many, this is now an opportunity, especially for people who are non-binary, to finally be able to have their gender properly recognized. So, as I said, huge step in the right direction. Doesn't go quite the full way that we were expecting, but hopefully in 3 years' time, when they do review this legislation, there will be an opportunity for us to go the extra step.
How can schools, educators, and families, and just the broader community better support trans students and children, especially in states where their rights are currently under political scrutiny?
People can do a lot on their own. There's a lot of really great resources out there that people can use to educate themselves, which kind of helps remove some of the onus of the individual to have to teach others. Like, for example, if I go to a doctor that I've never seen before and I don't know if they've been trained in trans healthcare, I often have to spend most of the meeting having to teach the doctor. So I'm essentially paying them to teach them to potentially not get the treatment that I'm after. So there's a huge onus, I think, on the individuals. If they wanted to be allies, if they want to do well, to look at some of these resources. So for teachers, I would recommend having a look at like Curtin's RSC project, look at GDHR, which is the Growing Developing Healthy Relationships website by the state government. They have some resources there that could be really useful. Minus18.org.au, they've got some great resources too. Transcend.org.au, that's the national organization for parents, but they have some great resources that allies could use too. There's a lot that we could do. Wear pronouns, respect people's pronouns. Wear pronoun pins, respect people's pronouns, treat people how they want to be treated, and educate yourselves.
What do you think some of the biggest challenges trans people are facing, not only in Western Australia, but in the country at the moment?
We know there's significant wait lists and significant capacity issues within the healthcare system in accessing gender-affirming treatment. So it's not just for people under 18s. We know, for example, the GDS and Gender Diversity Service have a wait list of at least 2 years. So usually by the time you turn 16, if you apply to it, you'll be aged out of the system by the time you get an appointment, which is really, really disappointing. Even with a lot of doctors who provide affirming care, will often have some extended wait lists, or there might be some extensive fees associated with having to see them. So unfortunately, the system as it is doesn't really have the capacity to meet the direct needs of a lot of people. Especially those in the regions where they're not able to actually come in person. We are aware of some places that provide telehealth support. However, their capacity is also very limited. If people are interested, we do have a recommended list services. So these are services that have been recommended by the community for the community. And it's got a whole list of doctors and psychologists and other allied health professionals who the community have vouched as being safe for them. So please feel free to reach out to us, and we're happy to provide that.
And what gives you hope for the future of transgender rights and healthcare in Australia?
Yeah, so we've seen some positive changes, as we saw with the gender affirmation reforms, with the birth certificates in last year, which is yet to be put in. The legislation itself has gone through, but the actual implementation should hopefully happen in the next couple of months, which is a huge step forward. I said before, it doesn't go quite far enough. However, in saying that, the government have also made some pretty large commitments, as I mentioned earlier, one of which is a whole of government strategy for LGBTIQA plus community members. And this is the first of its kind in our state. Victoria have one. And it's really great that WA is finally in a position where we're actually seeing a government that's committed to delivering it. And what that means is, for the very first time, us as a queer community-based organisation, we're not having to find alignment on very specific issues that fall out of the remit of the work that we want to be doing. Yeah. So we're not having to search for very specific schools projects that might have some alignment. This is a strategy that would hopefully provide some actions to providing funding and a commitment to developing our sector so we can directly have positive impacts on the communities. And I'm really, really excited about it. We have been asking for something like this for I don't know how many years now, but to see it to finally come into fruition is just, it's such a wonderful feeling. And I think there's a lot to look forward to in WA. Yeah. I know that things are pretty negative out there at the moment, but it feels like the direction that we're taking is that WA could actually be a bastion of hope for many people within the queer community. So there is a lot to look forward to.
Whilst the debate around this issue continues, one thing remains clear: transgender people need respect, support, and the ability to access the healthcare that they need. And whilst gender-affirming healthcare stays very uncertain in Queensland, it's never been more important that we show them this support.